Yes, there is, because of the statistic that shows that Hispanics disproportionately suffer more for certain chronic diseases, so it still exists. Language barrier could be a factor affecting the accessibility of healthcare and the utilization of healthcare, yes. Well, the Affordable Care Act has, well, of course, many provisions. Two of them is to provide cultural competency to the healthcare providers and to be linguistically competent in order to provide the healthcare in their language to help the patient have better outcomes, because if we bring the patients in, they could help the healthcare provider help them achieve better health outcomes.
Bueno, el Internet es muy importante ahora mismo, el día de hoy, porque obviamente todas las plataformas se presentan, además de en otros medios de comunicación, se presentan en Internet también. Es, yo diría, la principal plataforma para presentar cualquier campaña. Entonces, si nos vamos a la campaña de salud, obviamente tiene que estar presente en Internet. Y si es para los latinos, entonces con muchísima más razón, porque las estadísticas nos han demostrado que los latinos estamos presentes en Internet, somos móviles. Entonces cualquier campaña, especialmente de salud, tiene que estar presente en Internet, en cualquier tema que esté presentando. Prevención, así como curación. Entonces, en el caso de obesidad, si hacemos una campaña fuerte de prevención, que es lo que queremos nosotros como Grupo Parada, entonces tendremos un resultado mucho mayor, y ya cuando llegue al grado de curación será mucho menor y se gastarán menos recursos, porque la prevención es mucho menos costosa que la curación. Ya cuando se llega al límite, se llega al otro lado, como decimos nosotros.
I actually see that they embrace the Hispanic population, that they have access to care for all of our patients. They do not have segregation as far as our Hispanics, so it's a beautiful place to work at, and I'm so happy I'm part of Montefiore. Absolutely, we do have a mixed culture. We're like a melting pot. We have all different type of cultures in there. Hispanics, we do have customer service. They also offer interpretation, and that's something that the state requires as well, but we do have interpretation for our patients if they don't understand the English language, and we can provide that for them. And we do have Hispanic nurses. On my floor alone, I have about 10 Hispanic nurses. Absolutely, we should have a diverse staff, because that's going to serve the community that we have, and the patients are going to feel much more comfortable. They're going to feel safe. They're going to trust the healthcare providers, because they're going to be able to speak to whatever their needs are and be comfortable that you're going to understand what they're saying.
I'm one of those rare, very fortunate people who met the right person at the right time, who infused in me why I would be well suited for medicine. I think it's through events and activities like this, is to exposure to role models, and for us never to forget our roots and how much we need to give back. So I really, even though I'm a physician, one of the main things is it's not just the care of the patient, it's the care of a whole community, and just dedicating myself to the children and preparing the next generation.
There are just a few behaviors that are particularly important to health that determine much of our health today, which I'll be talking about later on. So there's smoking, healthy diet, physical activity, and alcohol consumption. Many people don't think about those four. So all of those are things where most people know what they ought to do, but they need to have those messages reinforced. So I'm here talking to Hispanic health professionals, and we're talking about how to reinforce those messages when they talk to patients. We are, in general, trying to get people to cut down on their consumption of sugary drinks, because they're particularly important to the obesity epidemic. And we are proposing to cap the size of sugary drinks in restaurants in New York City. And then we're, again, working with healthcare professionals to deliver the messages that people should stay away from them. They really do cause you to gain weight.